Hi, today I would like to address one particular issue about facial rejuvenation, which is called thread lift. Very frequently we are asked by our patients, phone and in-person communications, what does that mean? How much does it help? Can I have one of these non-surgical facelifts? And unfortunately, as someone who has been in this business and doing facelifts for over 30 years, my answer is negative. Thread lifts of different kinds have been in the market for about 12 years, probably more than that. Started in Asia, and Singapore, Malaysia, Hong Kong, and the first experiences that we have heard were very good, but unfortunately for a very short period of time, about 6 months, 1 year. So those experts, they have done hundreds of cases, would report on our conferences that yes, initial results are very good, but unfortunately we cannot maintain that result for a long time. And it seems to be continuous problem with these thread lifts. First, you cannot lift things just based on the threads. It just doesn't work. These threads are addressing very small area of the face or the neck, even harder to do that. A very limited number of threads is used for the neck, 2 or 4. Really does not mean anything for someone who knows the anatomy, who knows the reason for platysma bands and neck deformity, and even in combination with the liposuction of the neck, it does not work. So if you see some improvements, it is usually for a few months, and after that time these threads don't hold anymore, because this is a living muscle which moves with our animation, with movement of the head and neck, and of course the threads per se don't hold. Unfortunately, people keep inventing new threads, and one of these that is available on the market and very highly popularized on YouTube and on the internet is a silhouette lift, which is basically the same principle of putting the knots and threads in a certain areas of the face and then pulling that up to hold it. Unfortunately, all these areas are movable. As we smile, as we talk, these areas move, so the thread lifts don't hold. When you look in details, there are selection of patients, and I had before deciding to talk about this, I had to review about 20 videos, I think 22 videos about thread lifts of different kind, including several silhouette lifts I have reviewed online and YouTube mostly, and I found several things that are surprising. First, very few of these patients needed any kind of lift. Second, these problems that they presented with could be easily resolved with the fillers, not to mention that regular neck lift, anterior neck lift, which is a minimal surgery, but would address that problem significantly better. And the last thing about these, nobody's showing any postoperative results. Not even 3 or 7 days, where you would expect that with this kind of treatment results can still hold. Not to mention about 6 months, which is the first time that you can say this is it, this is how this is going to work for a long time. Further on, most of these people don't have any surgical training, so they are addressing the anatomy and problem without having a basic knowledge about that problem and basic knowledge of anatomy. So the way they are placing the needles and placing these threads really is not something where an educated surgeon who has done at least a few hundreds of these cases would do and put the pressure on and put the tension on. So to make it short, guys, this is not something that is worth of investing money and time. It may look cheap. I found that prices vary somewhere between $2,500 to $6,500. It is very close to having a good neck lift or face and neck lift. Few $1,000s more, and you are going to have result about 10 to 12 years of duration. So before undergoing this surgery, evaluate the pre and post-op very carefully. Talk to that person who is going to do that. I cannot call it surgeon because most of them have never had any surgical training, and be very skeptic about what they say. Unfortunately, in this situation, I have to use very unpopular words these days. Fox, these are fake news. Thank you.